by the DG. I really appreciate that particular type of leadership and direction that we are seeing. Honorable Minister, I'm going to try and avoid the questions that my colleagues have raised, but I am at pains not to take off from where Honorable Lenzana stood with regard to issues of quality assurance of the PPEs. That gives us sleepless nights because, Minister and team, if the quality of the PPEs are questionable, then it explains the challenge in terms of infection rate in the health sector. And I would really want to encourage the minister and team to engage the South African Bureau of Standards to make sure that whatever is produced locally in South Africa, but also that which is brought in from outside the shores of this country, is of a quality that can also enhance and protect the lives of our people. The equally so, it speaks to the issue of the cost of these PPEs to the state. I don't know why we are not able to make sure that the cost, especially even in terms of for the education sector. Minister Zwelim Kize, you would know that if there is low quality supply of sanitizers in our schools, as well as the quality of the masks, it is going to have a direct burden on the Department of Health, which is already burdened by the challenges that we have. Minister, another thing, it's very worrying. The situation that we heard and saw on TV with regard to the safety of our children who are quarantined in hospitals for COVID. I mean, how does it happen that a baby, because a toddler of 2 years is a baby, gets raped in a health facility? That in itself, Minister, you'd remember we reeling still from the challenges of the baby that was raped in the Northern Cape at 6 months, baby Tsepang, and the situation of babies being raped in this country is just worrying. And for babies to get raped in a hospital facility, it is actually even more concerning. And I would want to know from the minister and team, what is it that you together with provinces are going to do to enhance the safety of the people who are in healthcare facilities, be it babies or the most senior of the patients that you get there. And we need to actually, because I was looking at it, Honorable Deputy Minister Joe Patla, looking at that hospital
injury time,
and saying it would mean that the entire team in the hospital from the CEO down is already a suspect. I would do that as when investigating. But Minister, there's also another situation emerging at Tembisa Hospital. I'm taking from Honorable Mlenzana by raising hospital-specific issues, although I know that this matter needs the attention of Gauteng. But as the ministers overall responsible for the health of the nation, the horrors of horrors we read about the treatment of mental patients at Tembisa Hospital at Ward 7, as well as the medical patients at Ward 16, leaves much to be desired. Minister, there is an appeal from a family of Nomalanga Mguni, whose father was treated badly at Tembisa Hospital. I would give you the details at a later stage, as also Justin Kekana, whose aunt was also treated badly. I don't know, Minister, whether the medical legal challenges that we saw with regard to life acid has not taught us any lesson. And I think it is important that some of these cases be followed up and be attended to, because You cannot have a situation where people are treated like that. You carry the responsibility, Minister, and people will hold you responsible for this. But in reality, there are nurses and doctors and other health providers at the hospital levels who are not necessarily carrying through the Patients' Rights Charter as well as the Ppe principles. And they are creating nightmares for you, Honorable Minister. So I would believe that some of these things truly need the attention of the DG as well as the other health officials. I'm sorry, Chairperson, my apologies.
Apologies accepted. Honorable Kaiso.
Yes, thank you very much, Honorable Chair, and thank for the presence of the Minister and his team. We wish we had enough time, Chair. We are now under pressure because we want to deal with this issue of supplementary budget. We wish in future we have this full session with the ministry where we are able to elaborate more on the issues. But firstly, let me start with the difficult ones. The president spoke about the need of employment of about 12,000 health workers during this period. I just want to get from the ministers that do you think that maybe this supplementary budget and your reprioritization will it be able to accommodate this immediate injunction that has been made now by the president? Secondly is the reductions. There's also the question of infrastructure, the main infrastructure and maintenance, which is very central to what has been said by the president and many statements from have reiterated the importance of maintenance and infrastructure. But now here, it does seem that the NHI and other dilapidated infrastructure is going to be affected due to these cuts. And yet we are talking about re-engineering of primary health care, etc. But I want to get to understand how does this thing corroborate to the issue of the need to boost the capacity of health we can deliver during this difficult time, where there seems to be a concern that the dilapidated and infrastructure of hospital institutions will remain, affected by the cuts or reprioritization. Aren't you not concerned about this situation? Because I believe that this is the time that now these actually have to beef up instead of cutting down. And I don't want to talk about the issue of community health workers. It has been covered. I wanted to talk about it, but I think I'm covered by that, Chairperson. And lastly is on I want to ask this question, whether you actually agree with this, what the Treasury has done to cut 22.7 million reduction on NHI grant. Thank you very much, Chair.
Thank you, Honorable Kaiso. Honorable Tlangwini.
Thank you very much, Chair. Chair, let me just come in, and that's why it's so very hard to speak after Honorable Dipoer, because our way of questioning goes almost the same line. We think.
Okay.
Do you hear me, Chair?
Yeah, just hold for a
I lost the member.
No, just hold for a second. Honorable members, please switch on your videos. Please switch on your videos. Guys, your video is off. Madam.
It's difficult, Chair, on my video.
Okay, you can leave if it interferes with your connectivity. Please, you can leave. But the rest, please have your videos on. Honorable Tlangwini, you are starting from scratch, 0. Thank you.
All right, thank you, Chair. Now, as I was saying, Chair, I also just want to come in on on the the one of the 2-year-old child that was raped, sorry, at a health facility. You know, like one can just imagine what the parents must go through to land at that trauma. So, and the child itself. So the minister and this department need to take full responsibility for the incident, and we should even encourage the family to take the department to court, because they should ensure each and every person's safety, especially women, because we know what the crisis is with the rape culture, the abuse culture that are currently in South Africa. Men have declared war on women. So the department needs to take full responsibility in that regard of that 2-year-old that was raped at that facility. Two, Chair, it's on and the previous member have raised it on the infrastructure. We know about hospitals that are in dire need and the structures are falling apart. Now, the 1.1 billion that was cut on that infrastructure or projects that was postponed, where is the list of these facilities that will be affected? Can we be provided with a list? Even if it's not now, we will even accept it with a mail written response, Chair, via mail, so that we can know and track these projects that were postponed due to budget cuts and reprioritization and so forth. And then the last one, Chair, is on the quarantine sites as well, and linking it up as well with the understanded PPE. As the member of the Eastern Cape have said, there are now also a case where students are infected and it's going to go to hospitals and all of these areas where the departments are getting under quality or so forth. I don't know what is the correct English word, Chair. Otherwise, I will have to say it in Afrikaans. Sanitizers and PPE. What is the Department of Health doing in that regard to also ensure that these PPEs that are going to hospitals, clinics, and so forth are of a good standard and a quality standard? Because our health workers are complaining. And then also to come in on the Tembisa issue, because we all went and do oversight at the Tembisa hospital. There's a concern there about the manager of the hospital, and several healthcare workers have complained. He's running the hospital as if it's at his home, and he's demanding even sex for a job. So such individuals mustn't find space within our society and within the department. So what is the minister going to do regarding the Tembisa hospital in conjunction with the several complaints that Honorable Dipua have also mentioned about the mental ill patients and so forth at the Tembisa hospital? Thank you very much, Chair.
Thank you, honorable members. If I were to join, Honorable Minister, the President says about the proverbial silver lining of the pandemic that we are having. That do you see the department moving away from importing a number of the medical equipment and starting manufacturing here at home? For instance, I saw that you are buying a lot of thermometers. Are they locally manufactured or are they imported? But I'm just picking up on one. I would like to challenge the department to work on this one. The challenge to the department to come up with a strategy of using health budget and the health sector to reignite and transform the economy. So I'm challenging the department to work out on that because it's one of the departments which spends a lot of money, but would like to see that money circulating here in the country. So I've just given that, and I would like us to engage in future around this. And I think in the meantime, if you could start working out something, and would like to engage with it. My other question is around the bucket system, Honourable Minister. Kabazela, this committee has been seized with this matter of the bucket system and the health hazard that it provides. I just want to check whether with education or water and sanitation, whether you do engage, and what are the outcomes of that, because there's nothing of all the other things when it comes to this thing, apart from the indignity that it visits to our people, the health hazards, which I think your department would be better placed to share with us exactly what is happening around that, and when you engage with your colleagues, what is the outcome of it? Because it seems to be a perennial problem. What even worries us is that we have got budgets meant for this coming back and being money being taken back to National Treasury. So we'd just like to hear your comment. And lastly, from my side, what is the position about the claims against the department? We heard that these claims keep on growing and growing. Do you, let me say, are they under control? Are they perhaps some of the risks that may be facing us in future? Honourable Minister, you have until 20 past with your team to engage with the questions which you can today. But as the oral members were saying that perhaps some of these questions, if you were to provide them in writing, but I'll request you to deal with what you can with your team, and also greet the deputy minister. Welcome. Thank you, Kabazela.
Thank you very much, Honourable Chairperson, Honourable members. May I request that the first set of questions that relate to the financial issues be dealt with by the CFO. The next questions would be dealt with by the DG, and then the DM will come in, and I'll also come in. We obviously don't have a lot of time. It looks like from your estimation, we probably got 5 minutes each. And so we'll keep it like that. And then whatever we may not be able to deal with, we might just request that the members favor us with their script so that we are able to try and follow them up and respond, in writing and get back to you. So maybe...
Kabazela,
yes.
You have got until 25 past, so you've got 30 minutes amongst
30
yourself.
minutes?
Yeah.
Okay. All right, then between the CFO, let's ask the CFO to come through. Let's give him about, between CFO and DG, let's give them about 15 minutes. We'll come in at the end with the DM also for the same amount. Thank you very much, Chairperson.
Thank you, Chair. I'll look at some of the financial ones and some of the salient points that were raised. In terms of the initial request to the National Treasury.
CFO, can you switch on your video, please?
Sure, Chair. Chair.
Yeah.
All right. So just to say that on the matter of the 37 billion requests, obviously a number of items would not have been addressed by this, and would probably be addressed by the provincial equitable share to some extent. But let me just pick up on the ones that I think are quite important. First one was the issue of the oxygen, and there is a big matter on oxygen as it stands now, and we will have to request provinces to reprioritize to oxygen further. The issue of the pharmaceuticals, Minister has requested that there be a buffer of about 3 months on the pharmaceutical matter, and this has not necessarily been addressed to that extent, which also impacts on the supply of pharmaceuticals and our supplier capability. Although we've dealt with the matter of the HR in terms of the Cuban Brigade, there is still some shortages when it comes to the HR surge matters, and although provinces have employed quite a number of healthcare workers, those funds will have to come from the provincial allocations that have been earmarked. The HPV grant per se has not been reduced. It's still within the HIV component of the grant, but just to keep in mind that this is that the spend on this is very cyclical. Normally towards the end of September and then towards the end of April. I do believe, and I'm not sure, but there is some reduction of the numbers that needs to be vaccinated. The TB, the issue of the TB grant, again, as I said, is still within the conditional grant of the bigger HIV grant, and there was no real reduction in terms of that, but there was equally no additional funds also allocated to that. The reduction or the seeming reduction of the facility revitalization grant, again, it's an issue of reprioritization within the grant. So the funds do remain within that grant, although it would then be reprioritized towards the COVID activities, which could be quarantine facilities, some of the field hospitals. So that's where the reprioritization of the revitalization grant would go. Yes, it's true that it would mean that some projects would have to be either delayed or would have to be considered in the new financial year and not be taken up in this current financial year. That's a definite possibility. The other risk as well is that if there's been serious commitments on some of these projects, there might be contractual commitments and contractual matters to be addressed towards the end of the financial year on these projects. In terms of the quality assurance of PPEs, I'll just touch on that briefly. We have developed quite extensive list of specifications on these PPEs. We've identified about 17 crucial items on PPE. We've worked with the National Treasury in particular to make sure that the specifications are sound, and we're looking at a new set of specifications as well, which we'll first have to discuss with the National Treasury. As the issue of the cost of PPE, exactly, it's extremely expensive, and there's a big amounts going through on that. We have, in terms of the section or instruction note 5, fixed some of the prices on these PPEs, and given provinces guidelines to say that these are the maximum amounts that can be spent on a particular item of PPE. But Chair, you would also realize that it's very, very dependent on the supply and demand at the time. Yeah, so the issue of pricing, we've tried to take care of it through that mechanism. I think I've spoken about the issue of the reduction or the seeming reduction of the infrastructure grant. The NHI grant, the 22 million that is reflected there, is mostly for the recruitment of the GP contracting, and the only province that was affected on this one was Limpopo. So Limpopo was able to redirect some of those funds to COVID-19 activities. Other provinces' allocations essentially remained the same. So there was no reduction in that. In terms of, let me just touch on it briefly on the issue of the reignition of the economy. Definitely, we're looking at local suppliers, but not only local suppliers in terms of what's on the central supplier database, but also in terms of local manufacturing. And I did mention in particular the issue of the ventilator project that is coming off quite significantly. And although we do have a number of donations on PPEs, we have found that some of our donated PPEs do have issues of quality, which we have to refer back, and we actually working closely with the SA Bureau of Standards to have it tested before we distribute to the provinces. Chair, I think these were all the technical financial questions that were raised. Unless I've missed anything, I can then hand over to the Director General. Thank you, Chair.
Thank you very much, Honorable Chair Shrenge and honorable members. The CFO has handled quite a few questions. The one that I'll start with is how long will the restructuring of the department take? I must say we are very advanced with this process. We are now finalizing the business case with the Department of Public Service and Administration, and we're giving ourselves 6 weeks to finish the project so that it's finalized. But from the side of the department and the minister, everything has been done. We're just now working on the process to get approval from DPSA. And then in terms of the vacancies, may we request that we submit, we do have this information quite detailed. We will submit that in writing to the Honorable Committee through the Secretariat of the Committee. The issue of community health workers that was referred to by one of the honorable members, it is an issue that has been on the table for a long time. Maybe the minister will touch on that one, but there is a National Health Council decision on how they should be handled. There was never an intention to have them employed full-time, but there's quite a strong pull that has been put in place for the provinces. And I must say that it has moved a long way. Initially, some were employed by NGOs, some were employed by government, and then that was corrected. There was also standardization of the stipend and linking it up with the minimum wage in South Africa. So there is work to that effect, but the department is continuously working on that together with the unions. And there is an agreement actually signed with the unions at the Health Sector Bargaining Chamber on this matter. And then the specific questions on a number of facilities, including Stulenkama, Eskangeni, Maluti Health Center, I would like to go back and so that you are able to report accordingly on this one. The CEO has touched on the PPE, and we must say that as a department, we are seriously worried about the loss of life for the healthcare workers due to COVID. And we're doing everything, working, of course, with the unions and a number of structures to ensure that this matter is addressed. I must also say that through our infection prevention and control, we've made a guideline available for the NGOs, my apologies, for actually the workers to say who should use what. For example, a nurse who's working in theater cannot use the same PPE as a security guard at the gate. There are specifics that who should use what, but sometimes there is a misunderstanding which we continuously communicate. For example, that you cannot have an N95 mask if you are working at the gate or you are a cleaner. But if you are in theater, this is what you use, this is what you use. So that's a continuous exercise so that we understand each other. You will then find out that in some of the areas, not that we're saying there is no shortage of PPE, it's just a misunderstanding that a person at the gate wants to wear the gown, wear the goggles, wear the shoe covers, which is something that is really reserved for people working in theater, in ICU, and in high care. Then the next one I would like to touch on is the issue of the recruitment and the 10,000 healthcare workers that were referred to by the president. The problem that we have here as a country is a problem of supply in terms of the human resources. I must say that the minister and the president has gone out to say, if you know any doctor who meets the regulatory requirements, we must note this one. That means that if there is any doctor who is registered with the council who's looking for a job, the minister has gone out even through the medical association, SAMA, and the other structures to say, please submit those names. There should be no doctor who's unemployed during this time. So basically that has been opened and it's an ongoing process. I must say that also with the competition that we're getting from the private sector, currently we are actually even trying to recruit nurses through the nursing agencies. And they give you the numbers today, If you go back tomorrow, the numbers have changed because we are actually getting from the same pool with the private sector. But I must also add that in terms of sharing of the resources with the private sector, the minister has actually provided stewardship, and we've actually even agreed with the private hospitals how they can assist us to manage the patient using the skills that are there, the beds that are there, the equipment that are there, and we've even agreed on the tariffs, which is a per diem tariff that we've agreed on, which is actually a very good base for us even moving forward on how we're going to work with the private sector. And then on the issue of the manager of Tembisa and other issues at Tembisa, I would like to request that I go back and discuss with my colleague in Gauteng and we provide a thorough response onto that one. I will stop there, Honorable Chair.
Agreed, Chair.
Yes. Yeah. Okay. Thank you. Honourable Minister.
Thank you. I was just checking if the DM is ready to come in, but if not, we will proceed.
Kabazela, I just want to make a few comments on the matters which have been raised by the honorable members. Firstly, your concern about compromising other services such as HPV vaccines, TB, HIV. We are quite conscious of the risks as we focus on the COVID-19 pandemic, that and it is quite documented actually that we've had some kind of shortcomings in terms of the uptake of patients coming through to the health facilities to obtain treatment, that, and also especially in terms of getting new patients, the testing on HIV, TB, that there has been some fault line which we have noticed, and this is being attended to make sure that as we focus on the COVID-19, we don't then have a shortfall in terms of the other continuing burden of disease, communicable diseases such as HIV and TB, and also non-communicable diseases, your diabetes, your high blood pressure and cardiac diseases and so on, that because we're aware that it's both in terms of the facilities themselves making the conditions quite conducive for patients to come in to obtain services, but also we need to deal also with the fear, because it is a known fact that also the community out there is also fearful in terms of getting into health facilities with the fear of ending up with a COVID-19 infection. So these are matters which we're quite conscious of, and we're trying to close that gap, not only in terms of the funds, the reprioritization of the funds, but also just in terms of making sure that we don't deal with the pandemic on the one hand, but then end up with many people suffering and even dying from other conditions which are quite prevalent in our country. So a study has been done. We have actually established that this